Chapter 13, Texas Southern University Health Class.
Infectious diseases. Infectious diseases are disorders caused by organisms such as bacteria, viruses, fungi, and parasites.
The body. A healthy body has CD4 helper lymphocyte cells. These cells help the immune system function normally and fight off certain kinds of infection. HIV attaches to these CD4 cells. The virus destroys the ability of the infected cells to do their job in the immune system. How do we do?
There are many infectious diseases. The one we will be focusing on today will be HIV/AIDS.
HIV is the virus that causes acquired immune deficiency syndrome. The virus weakens a person's ability to fight infections or cancers. People with HIV are said to have AIDS when they develop certain infections or cancers, or when their CD4 T cell count is less than 200. Having HIV does not always mean that you have AIDS. It can take many years for people with the virus to develop AIDS. HIV primarily infects certain white blood cells, CD4 cells, that are critical for a healthy immune system. Eventually, the virus can disable the immune system, leaving the person vulnerable to a number of life-threatening diseases or illnesses.
The early stage of HIV is within 2 to 4 weeks after HIV infects many people, but not all people receive the likely symptoms, and it's the body's natural response to the HIV infection. It contains fever, swollen glands, sore throat, rash, fatigue, muscle and joint aches and pains, and also severe headaches.
If you have HIV and you have not taken medication, the HIV virus weakens your immune system and transitions to AIDS. During the late stage of HIV infection, people infected with HIV may have the following symptoms: rapid weight loss, recurring fever, or profuse night sweats, extreme and unexpected tiredness, prolonged swelling of the lymph glands and in the armpits, groin, or neck, diarrhea that lasts for more than a week, sores of the mouth or anus or genitals, pneumonia, red, brown, pink, or purplish blotches on or under the skin inside the mouth, nose, or eyelids, memory loss, depression, and other neurologic disorders. Testing for HIV includes blood tests, oral fluid, or urine samples to detect the disease. Testing is confidential and cannot be shared without permission. Ages 13 to 64 should be tested. The earlier HIV is found, the faster it can be treated. The primary exposure risk for 88% of HIV is sexual conduct. You should be tested every 6 months to a year. 1 in 7 Americans live with HIV.
These are some ways to prevent HIV and AIDS. Here's a female condom and a male condom. Use new condoms every time you have sex. Letting your sexual partner know if you have HIV. Using clean needles if you inject drugs. If you are HIV positive and you're pregnant, let your doctor know and receive medical attention right away. Consider male circumcision. Flip to the next page.
So I know we've all had those nights where maybe we weren't so preventative and we said, forget the condom. So what we have here is our 5-day treatment process. It's called Save a Viral. And how this virus is treated is through an injection of the needle. Can you demonstrate for me? So here is our lovely demonstration. She has HIV/AIDS. She's been living with it for about how long now?
3 months.
3 months? Okay, so today we're going to treat you and we'll show you how it works. So it's going to be a 5-day process. Day 1, we will, alcohol swab. You've already swabbed her down?
Yes, and you just
okay. Oh, I'm sorry. Can you re-swab? Okay. So then what we'll do is inject her with our serum. Our serum is a 5-day process and it works like magic. Within 5 days, the patient is treated. So now you don't have to worry about that whole, oh my God, I think the condom bust. Oh my God, he didn't use protection. You take your plan B and come to our laboratory and get treated right away. Shot, ask them for the shot and the plan B. No babies, no diseases. You can contact us at 1-800-SAVE-A-VIRAL.
Just take that last letter first.
Okay,
You spell it.
we're able. Okay, let me
Good.
see the last part.
You fine.
Okay.
You just cut that little part right before. You didn't like what you were saying. And just leave the one I said already on there. Because I don't want to be talking. And you can understand what I said about the fact that you was fine. Good to do.
So, you'd like to know a little more about what's included in our vaccination. It is an antiviral vaccination that is effective against the HIV-1 and HIV-2. In particularly, it has a natural resistance to NNRTI, which is an anti-retrieval drug. Our antiviral vaccination uses nucleoside reverse transcriptase inhibitors, which include Videx, Videx EC, and Imtriva, protease inhibitors, Persista, fusion inhibitors, and entry inhibitors. Diagnosed with HIV antiviral vaccinations, this can be administered within 5 days. All signs of HIV virus will be removed from the body.
All right, like always, there are symptoms and side effects that may occur. You may get runny nose, fatigue, lack of energy, diarrhea, headache, and nausea. But those are maybe a 1% chance. So if you would like to come and contact us and get your treatment today, call 1-800-SAVE-A-VIRAL. And